I'm being terribly negative this morning. I dare say if somebody gets bad news, for want of a better word, having underwent a test, and they fail to engage with a counsellor properly, could it lead these individuals to some form of depression or some event in their life that makes that counselling almost essential, particularly if their mind runs riot with this news they've got, maybe unexpected news or maybe anticipated news, but once they get it, they can't manage it. Yeah. So would you say it's absolutely essential?
I think particularly for conditions where you can't do anything about, it's really important that people have the opportunity to discuss that. So one of the tests that's been around for the longest actually in the NHS is for conditions like Huntington's disease, where at the moment there is no treatment for. And I think that's incredibly important that people have access to really skilled genetic counselling from anyone within the clinical genetics profession, I would say, so that they can really talk about whether they want that test or not. And we know from quite a many years' experience there that many people, when they have that opportunity to discuss it, decide they don't want the test. Yeah. So people say they want it, come forward, talk about it, and then most of them actually fall away. Yeah.
I suppose to pursue that, because I know, Professor Middleton, in your evidence, you said the situation with regard to genomic counsellors was in dire straits because of the numbers and the retirements that are coming. And clearly we've identified a very real need and an essential part within the NHS and genetic testing for this counselling to exist. But there is going to pressure come from the private companies if they're required to provide counselling. So how do we reconcile this problem of the fact that we're going to hit the NHS that are identifying people that need genetic testing, identifying the support that's needed, because the support's not going to be there physically because of the lack of numbers. So how do we balance this where, NHS should take priority, but then we've got private companies that are making money on the back of it? How do we square the circle?
There's so many ways to think about it, and actually many of the companies do have genetic counsellors on their staff to write their patient material, their customer material, but they're not using them to actually counsel their customers, which they should be. They should be using those skills. And a big concern is this sort of skills drain from the NHS out to industry, particularly when they're being offered 3 times the salary to go and work in industry. And some of the big companies have enormous teams of genetic counsellors. It is something that we're very worried about, and we've been pushing quite consistently over a number of years to increase our training. So NHS England, Health Education England, we've been pushing to increase the numbers of trainees coming through, but also because we have so many really senior genetic counsellors retiring over the next 5 years, we need a recruitment push to bring in more, senior people into the profession. And that needs resourcing, and we've been pushing for that as well. So if there's any outcome from this that can help with that, we'd be very, very grateful.
So should the companies, we've talked about re-evaluating the data second-hand and then non-medical but medically labelled stuff coming out. Should the companies be responsible for the pickup for the genomic counselling that at the minute is just falling on the NHS once you've got through the barrier of the GP?
Yeah, can I answer that? So, a few of the companies offer testing for really serious conditions, so young onset Parkinson's, Alzheimer's and breast and ovarian cancer. And if you have those tests, what they offer in terms of counselling is access to a YouTube video that tells you how great it is to be informed of your risk. And no actual direct link to a genetic counsellor who can actually support you. And often people don't know they're going to have an emotional reaction until they have it, because that's the point where they say, oh my goodness, how am I going to tell my parents I might have an increased risk of Alzheimer's? Where's it come from? It must have come from one of them. And then you start to think about, well, what's the actual implication of this? So yes, I would say the commercial companies have a duty of care to their customers to pick up the pieces and not just rely on external, people who aren't even paid by them to pick up the pieces.